Sure, let's go ahead and get started. Thank you, everyone, for being here on your Friday afternoon. We are so excited to show you our new social determinants of health data dashboards and for Andrew to give y'all a walkthrough on how you can use the data and explore the data and what we've been doing to use our data for good. So we can just walk y'all through what the agenda is going to look like today. If we can, so we're going to go over a few housekeeping rules for how we'll be conducting the webinar. Then Andrew will take y'all through what data ViaLink collects, the needs data and our resources data, and then our new social determinants of health dashboards, and then how you all can use ViaLink's data, and then we will have plenty of time for question and answers afterwards. So a few of our housekeeping rules or announcements. To access closed captions, please click on the closed captions live transcript button in the meeting control panel at the bottom of your screen. All of our audience members are going to be muted, so please use the chat or the Q&A buttons to submit any comments or questions throughout the webinar, and I will be moderating those to be sure we address all comments and questions at the end. We are recording this webinar and it will be posted to our ViaLink website so everyone can have access to view what we go over today afterwards. And for those who are unable to make it live, they will be able to get the information. If you do experience any internet issues, you can dial 646-931-3860. And the webinar ID is 812-9874-1568. So just to go over who we all are today, my name is Sherrod Crespo. I will be the moderator for our webinar today. So I will again be keeping an eye on the chat and on the Q&A to make sure we address all comments, questions, concerns at the end of Andrew's presentation. I am the director of our Outreach and Prevent Child Abuse Louisiana Department for ViaLink. Also joining us today, we have our president and CEO, Lavondra Dobbs, who will be here to answer any questions or comments. And to do our full presentation and also answer any questions is Andrew Holbein, the Director of Resources and Data. So we're going to hand it over to Andrew so he can show y'all all the exciting things.
Thanks, Sherrod. You're the best. So hey, everybody. I'm sure that a lot of folks on the call, most of you have some familiarity with ViaLink, but just to talk a little bit about what we do. So ViaLink is a 501c3 nonprofit. We've been serving people in Louisiana and beyond for more than 100 years. A fun fact that ViaLink was founded in the 1920s during the Depression. It was a group of volunteers got together to help gather and provide resources to people who were in need. So a lot of the work that we're doing today is still similar to that kind of work. We run a range of programs. Our biggest program is our Crisis Contact Center that manages and answers more than 25 crisis and human service lines for our region. So those are systems like the 211 system or the new 988 mental health and mental health crisis lines and a number of other ones. We do different homeless services such as managing the HMIS system for our region, and we've started providing care navigation for people in Orleans and Jefferson who are homeless or at risk of homelessness. We provide different data and database management services. Cliff Harris is on this call. He's the director of our IDMS program or department where a lot of those services sit underneath, including the data work that we're going to walk through today, the HMIS system and other services that I'll talk about. We do work in the prevention of child abuse realm. Sherrod, as the last slide showed, directs the program of us being the Louisiana affiliate of Prevent Child Abuse, the affiliate of Prevent Child Abuse America for Louisiana. And I mentioned we do care navigation services, so that's where we work with people on an ongoing basis to identify their needs, connect with services, help them enroll in services, and just sort of provide ongoing wraparound support with them. So jumping ahead, I know probably most people here again are familiar with social determinants of health, but just a quick slide to make sure we're all on the same page. I've seen a lot of definitions of social determinants of health. I think that this one's a nice simple one: non-medical factors that influence health outcomes. So, those are things external to you. It wouldn't be something like your high blood pressure or your predisposition to different diseases. It would be things like your neighborhood, the community you live in, your access to transportation, job opportunities, nutritious food, clean air and water, and everything like that. And so ViewLink has, I think ViewLink is unique as a nonprofit in that we generate a lot of useful data that can be used by a range of organizations. And we really have two types of data that inform regional social determinants of health analysis. And I'll walk through those in a little bit more depth in the next couple of slides. It's our needs data that comes from our contact center, and then also the data that comes from our resource database that sheds light on things like resource availability to address social determinants of health. So just where does our needs data come from? As I mentioned, we run a crisis contact center that's staffed by about more than 40, I think it's going to be close to 50 soon, call specialists, very trained people. A lot of them have masters in social work or counseling. They're overseen by a really terrific team of on-call supervisors who are, really doing best practices and in the type of crisis and information referral work that we're doing. So we work with tens of thousands of people a year. Sometimes it's more than that. In 2020 with COVID, we worked with more than 100,000 people contacted our contact center, same more than 100,000 in 2021 as we dealt with Hurricane Ida. And so some of those folks contact us and they're just looking for, say, emotional support if they call the 988 system that we manage. But a lot of them are looking for, have specific needs that they're looking for referrals for, and so we capture that information and it creates a really large, rich data set that's being updated daily. And one of the big parts of that data set is needs data. So the people who are contacting us, who are needing referrals for, say, food, for example, we capture that data in a very granular way. It's not just sort of in our database of like they needed food assistance. It gets really specific of like they needed a mobile market, they needed a farmer's market that accepts SNAPs. They're looking for signing up for WIC. They're looking for food pantries that work specifically with people with AIDS. So it's, it's really sort of nuanced, granular needs data. And then, since we collected from so many people, we can look at how the needs vary by things like demographic. We capture demographic data as much as we can. So by race, by gender, by age, and how that data, changes by time, by year, by month, and also how it changes by location. And so the other big source of data that informs social determinants of health is our resource database. So, we're making referrals to so many tens of thousands of people that creates the need for us to maintain a really comprehensive database of health and human services resources. And then, during disasters, we create kind of a new databases. Like during Ida, we were tracking at one point, I think more than 500 different resources that had popped up around, transportation and feeding people and that sort of thing. So the database is the largest in the state. It's maintained by 3 full-time resource specialists, as well as an AmeriCorps Vista position. And, those are, I think, probably for a lot of us who have worked in nonprofits, at some point or another, we have to put together like a resource guide, and we're just sort of going on Google and looking up resources and, writing down a few things about them. So these staff are doing, much more expansive work than that. They're accredited by the Alliance of Information Referral Systems, which is the organization that accredits organizations like ViewLink that do information referral work. And so they're working at very specific methods. They have a very comprehensive database that tracks about 70 different points of information about all the agencies and programs that we have in our database. Our lead resource specialist, Deanna Allen, she has more than 10 years of experience managing these types of databases and really, takes a lot of pride in her work of curating and updating and expanding and maintaining this database. So it has, thousands of resources in this database, and that is useful in a lot of ways. And one of the uses is that it can sort of see where there are resources, where there are resource gaps that can help inform, social determinants of health, and, are people able to get to the resources that, would help them address those social determinants of health. So let's jump right into looking at our dashboards, the ones that we've created that combine these two different types of data. So I'm on VLink's homepage right now, and if you go here to the tab, Social Determinants of Health, so we have a bunch of dashboards, but today we'll look at our Social Determinants of Health dashboards. We have three dashboards. We have one that looks at food needs, and food resource availability, housing, and economic stability. I won't go through all three of them since they all kind of share a similar format and layout and functionality, but I'll look at the food one. So if you click on here, it opens up and it'll take us to a landing page that we can use to navigate throughout the dashboard. So these dashboards, they combine the two types of data that I talked about that VLink collects are the data from our contact center about needs of people, and then also information from our resource database to see about resource availability. And they also incorporate a third type of data, which is external data. So that external data is on this page, and it's data from places like the census, Feeding America, DCFS for SNAP usage rates. So that's here on this page. This is the page that includes data of needs from our contact center. This is the page that shows data from our resource database. And then this page has analysis, and there's an additional analysis kind of sprinkled throughout the other pages. So if you click on this, it navigates you to our external data page. This is showing the map showing food insecurity information. If you click on these icons, it'll show you the source, and they're hyperlinks, so you can jump to check them out. And it shows things here like food insecurity rates by parish, number of SNAP recipients by parish. So different data. Obviously, the other dashboards, contain different metrics and different sort of data sources that are relevant to housing and economic stability. So if you navigate to the second page, this is the food assistance request. So what we have here is a map showing dots for zip codes where we've gotten requests. The more requests we've gotten, the larger the circle is. You can see obviously the biggest concentration is in the greater New Orleans area. And so we can see things like changes in the number of requests that we are getting per month for food assistance over time. You can see that actually the number of requests was dropping after 2015, which mirrors what parishes in our region were experiencing in terms of a decrease in food insecurity. Then obviously that changed in March and April of 2020 with COVID starting. So we saw a very large increase in people needing that type of assistance, and it actually reached its peak. It dropped down and then reached its peak after Hurricane Ida, in the month after Hurricane Ida. This sort of summarizes the type of assistance that people were looking for. Food pantries is the biggest category of foods needs, followed by government benefits, and then meals. So dashboards have some nice filtering ability that can allow users to explore the data themselves. Like you can click on these bar charts and it filters the other charts. There's also a filter here for parish. So if you're interested in a specific parish, you could do that, or you could use this slider to to filter by date. So in all of our dashboards, some of our other dashboards include like demographics, filters, and things like that. So it allows you to really kind of explore the data yourself and kind of draw your own conclusions. So this page of the dashboard shows food resources from our resource database. So each of these dots is a food pantry. So these are and I should have mentioned that this dashboard is looking at specifically Southeast Louisiana, the 10 parishes of Southeast Louisiana, where we answer the 211 system for. So it's the 10 parishes listed here. And so you can see that, the greatest concentration of food pantries is obviously in the greater New Orleans region. Here's number of food pantries per parish, sort of analysis of there's one food pantry for every 1,800 food insecure people. So that's what this page shows. And then the analysis page gets into some deeper analysis, like, for example, this chart here talks about how obviously Orleans Parish has 29 food pantries, which is a lot more than Plaquemines Parish, which only has 4. So you might look at that and sort of think there's, lack of resources in Plaquemines Parish. But what the chart on the analysis page is pointing to is that there's actually a much higher concentration of people in poverty in Orleans Parish. So there's about 90,000 people living in poverty in Orleans Parish, whereas Plaquemines Parish, which is obviously a more rural area, there's only about 3,000 or 4,000 people in poverty. So from like a total standpoint, Orleans does have more food pantries than Plaquemines Parish, but if you actually look at it as food pantries per 1,000 people in poverty, there's actually Plaquemines Parish has the most per 1,000 people in poverty of any of those 10 parishes, and Orleans is third to last down here. So, just kind of digging deeper into the data to see more kind of trends like that. So I won't walk through all the dashboards. As I said, they're all published here on ViewLink's homepage, along with some of our other data, and we will be expanding that in the months to come, the number of different types of social determinants of health that we're looking at. So jumping back to our presentation, I'll give just a little bit of information about how organizations can work with ViewLink's data. So as I mentioned, we'll be launching more social determinants of health dashboards in the month to come. And we have our resource database is online. So if you went to our homepage, instead of clicking on Explore Our Data, you went to our Resources tab, you can see to search our resource database. So, and this is the database that, it hooks in. It's the sort of public-facing version of the database that has, the thousands of resources. So you can search in a couple ways. You can go here, and this is what we call guided search, where you can search for specific, categories of needs, or there's just this free field box where, say, you wanted to look for food pantries in the 70119 zip code where I'm located right now. So that'll do a search, and it'll map the food pantries there, and you'll be able to see them on the right hand side. You can kind of zoom in and out, and the map will add or subtract resources. And then you can, look at specific resources. You can contact, as it's mobile optimized, so you could, give a call to the organization, or you could send this resource. If I was working, say, with a client who was sitting at my desk, I could email them the resource, or I could text it to them. And then if you can click on the resource to get some additional information, fields like the eligibility requirements, program fees, that sort of thing. We have the ability to translate this so that, if there's a Vietnamese user who wanted to view it, they could, view the information in Vietnamese. We have the most commonly spoken languages in Southeast Louisiana here. So I don't speak Vietnamese, so I'll jump back to English. But yeah, so this is our resource database, and you can use this to start doing some kind of like rough analysis of resource availability, and how that changes by location. Some people, they use that, but then they want to kind of get more nuanced, or get the data in different formats, or, with expanded information. So if you're interested in that sort of thing, of working with our resource database, here's my email address, and you can feel free to reach out to me. ViewLink, we're always interested in partnerships. I see on the call is our good friend Steve Mumford at the University of New Orleans, who we worked with him last year to do what I thought was a really interesting analysis of resource availability needs based on our data, and we wrote an extensive report that's available on our website. So Steve and I, formed that partnership through his interest in digging deeper into our data and us making that available to him and his students. We also create customized dashboards for organizations. We've had a lot of organizations come to us and say that they want to start using dashboards, or that they want a dashboard that combines our data with their data, or combines their data with, census data or something like that. And so we build dashboards for organizations. We can train staff on how to use them and how to start working, with dashboards themselves. Another sort of tool related to this that we offer, sometimes organizations are interested in the online resource database that I showed, and maybe they're interested in viewing like a subset of the resources, maybe resources just around employment, for example. So we can create versions of our online resource database that are subsets of these resources, and can have the branding of that organization, their colors, their logos, and everything, so it looks like their tool, and help them embed that on their website. And then when our resource specialists are updating our database, it just feeds through right into their database. So yeah, all those, I'm always happy to talk and brainstorm around those things. My email address is down here, aholbein@vialink.org, and just shoot me an email, and happy to chat more about that. So now I'm going to hand it back to Sherrod, and I think she has some questions that she's created for Q&A, and then it's a great time for people to drop their questions into the chat, and we'll pull in our CEO, Lavondra.
Thank you so much, Andrew. Andrew already even told me all this yesterday, but it's always so amazing to see a walkthrough. Let's see, some questions that I have. Actually, my first one is to Lavondra. Lavondra, how has ViaLink's role providing data to the community evolved over the years?
Thanks, Sherrod, and thanks for that presentation, Andrew. Really good. So ViaLink has always collected data from our callers based on their needs and demographics, and we've always had a resource directory. So we eventually realized that we were really sitting on a treasure trove of information, and our work in building these databases really came to fruition when I was in a meeting with some folks several years ago, and it was actually some folks from Second Harvest that said that they were wanting to expand their food pantry locations, but they really weren't sure where to put them, and they knew they needed to have additional services there. And I was like, we can help you with that. We know where the people are calling from that need help. And that got us started on mapping out where the needs were and working on where additional food pantries need to be. That work has grown. I think these dashboards and our data is a great resource, not only for other agencies in looking to where the needs are and have some specific or targeted work. It's also great for grant writers to use to build their case. In supporting agencies, it's a good tool for foundations to use to see where the needs are that they would like to fund. And of course, any government entity, it's great information on helping them do a deeper dive into their communities. Did I answer your question?
Yeah, perfectly.
Okay.
And you mostly answered this one, but just to make sure that we talk about it specifically, Lavondra, what types of organizations could benefit from ViaLink's data?
So, like I said, any other nonprofit that needs data to build their case for funding or for growing programs or servicing their specific populations. Foundations could use it. on how to build on where to fund. And I think it's great for the general public to know what the needs are in their community and where those resources are. And then those that at the state level as well and parish level governments. So.
Yeah, I'll add on to that, Lavondra. You know, there's been some interesting specific use cases, like during COVID. I remember you telling me that the City of New Orleans Health Department was using the data that we had on our COVID dashboard about where people were requesting testing to figure out mobile distribution sites. I remember you started that partnership with Second Harvest, and during Hurricane Ida, they were using our Hurricane Ida dashboard to see where people were calling, requesting food assistance, and you know, informing their mobile pantry work. So yeah, it's a lot of different.
That's right. And then also during Ida, we took our resource data a step further and we mapped it. So Andrew and his team were updating this daily. It was like a map with different icons that showed where ice was available, cooling stations where you could get gas, water, food. And not only individuals, but a lot of agencies and organizations here that help to do the work in cleaning up and restoring the city or the most parts of the state. Told me at the ResCon conference this past year that they use that map for where to send people and go themselves to get data help. So a lot of uses there.
Lots of uses, and they're amazing that they're so easy to read and to interpret. I am not good with tech or data, and I love being able to utilize these. So Andrew, I do wonder what is involved on your end when you're creating these type of dashboards.
So we use, for these dashboards, there's different like data visualization softwares that are out there. We use Power BI for our dashboards. It's Microsoft's data visualization software. Kind of the like most widely used softwares are Power BI and Tableau, but there's kind of a bunch out there, especially for like sort of niche, you know, industries. You know, it's not hard to use that software. Power BI is great because you can download Power BI desktop for free and, you know, start making data visualizations. And then there's an online sort of cloud version that you have to publish them online. But for a nonprofit, it's $3 a month. So it's, you know, very affordable to start using these kind of tools. You know, there's a lot of resources out there to learn on your own. Obviously, like a lot of YouTube videos and stuff like that. So it's to start doing, you know, creating data visualizations and dashboards and publishing them online is, you know, it's very doable. It's very attainable. You know, we've worked hard with professionals in user interface design, user experience design to create these dashboards, and you know, folks with deep knowledge on sort of database structuring. So that, you know, has helped us. And I think helped us create sophisticated dashboards that, you know, as I said, if organizations are wanting to skip all that and just kind of jump to the end, you know, that's why we kind of have started to provide that service of just building dashboards for other organizations. But yeah, it's at the end, it's, you know, it's very doable. And you know, the great part about it, Shared, like you said, is, you know, helping people who aren't comfortable with data, you know, feel sort of comfortable and empowered to explore data in their region is sort of the, you know, the whole goal of it.
Yeah, and so easily accessible and for free for all of these public facing dashboards. And I love how internally with us at ViaLink, it's really created a cohesive partnership between the departments of information and data and the contact center, and we can work even better together. So Lavondra, I'm wondering, for the contact center side of things, do you see that, do specific phone lines create interesting data like 988 versus the opioid texting or the teen text line?
Well, I think some of the interesting information isn't always just on one particular line. There are unique cases with each caller. It's the, probably the human side of it, such as, we're doing a program now with using Lyft that Blue Cross Blue Shield has funded to give rides to medical appointments and cancer treatments. And, somebody may have some mobility issues, but they can use public transportation, but the sidewalk in their neighborhood is in such disrepair that they can't use their walker or their mobile unit to get to the bus stop. So, it's just, so you think you've got public transportation, but then you do a deeper dive and you see there are other issues that are preventing people from using that. It's got to be a, total picture solution there. So those type of things I find interesting, and what you really just can't look at the surface level of the data. Like, oh, well, they've got public transportation, they can use that. What are the issues that are keeping people, and how can we fix that? But two, with the, I just want to say, these dashboards that Andrew has built and now shared with the contact center, it lets them see visually, that visualization of the data that they've been collecting. And they understand the value of it and how important it is to get it and what we can do with that information.
Yeah, from the contact center specialist truly taking someone's needs and their stories from what might not even be a resource call, but being able to document it as the human need so that we can use that data for good, not just for programmatic or policy change, but for community needs as well.
Mm-hmm. Right. Absolutely.
Yeah, and as Lavondra mentions, some of the lines that we run, we're about to launch a new dashboard soon that shows calls from the 988 system that we answer for our region, and we're going to launch shortly a dashboard that I'm really excited about that combines our data with an ocean of data from FEMA about Hurricane Ida that I think will be really helpful to organizations working on the recovery, and that we plan to replicate for future disasters in our region, which hopefully there won't be any other for many years to come. But on the off chance that there is, we'll be ready with that.
Yes, everybody collectively knock on wood, but we will be ready.
Absolutely.
Well, I truly just think that these dashboards are so neat. And I think it's such a great direction that our agency has been able to go to. And I just thank you so much for that, Andrew. And that's all my questions. Does anybody and our attendees have any questions? I don't see anything in their chat or the Q&A at this time, but we are here to answer them. Well, I do not see anything for now, but it's probably because you did such a phenomenal job covering everything, Andrew and Lavondra. Thank y'all so much. And we thank y'all again, everybody, for being here. And you can please learn more by visiting our website. Please contact us through our website or through our email. We're always available for questions. And we just really want to make sure that we're serving the community and others who are in the helping profession as best as we can.
Thank you, everyone, for attending.
Thanks very much. And thanks, Sharon, for moderating.
You're welcome.
Oh, we got one Q&A
From Stephen Mumford. Thank you all. Thank you.
We appreciate you, Stephen. All right, everyone. Well, enjoy the rest of your afternoon and enjoy the weekend.
Thank you.